And on COVID watch, Kenyans who have been fully vaccinated with Pfizer, AstraZeneca or Moderna vaccines and taken COVID-19 booster shots 6 months after their initial shots are encouraged to take a second booster shot immediately. Those that took Johnson & Johnson vaccines are advised to take a booster shot after 2 months. This is the new stance by the Ministry of Health, which projects that the rate of new COVID-19 infections is likely to increase in the month of July due to cold weather in many parts of the country. Health experts are cautioning the public not to abandon health protocols aimed at containing the virus. According to the Ministry of Health, COVID infections are on the rise. Health experts continue to call on Kenyans to get vaccinated to boost their immunity. Kenya uses the AstraZeneca, Sinopharm, Moderna, Pfizer and Johnson & Johnson vaccines.
Currently, we have about 28 million doses of 4 types of vaccines. We have J&J, we have AstraZeneca, we do have Pfizer, and we also have the Sinopharm. The vaccine that we do not currently have is Moderna, and we are trying to make arrangements to get Moderna soon.
As of July 7th, 2022, 32% of adults were fully vaccinated.
I must say, especially from the period of February up to now, there's been a low uptake of COVID-19 vaccines, mainly because of the low positivity rate. There were few cases being reported, there were few people being admitted, and to many Kenyans, it's like the pandemic was over. They saw no reason to take the vaccine. But as we had predicted, especially as we started the cold season, the cases would start coming up again. This pandemic is not over.
Out of the 28 million vaccines available in the country, 9 million persons, including the adult and teenage populations, have been vaccinated, while only 500,000 booster doses have been administered.
We describe our vaccination as what you call primary series. Primary series is you got 2 doses. After the 2 doses of either AstraZeneca, Pfizer or Moderna, you take your first booster 6 months after your primary series. But now we are recommending, starting immediately, that people get a second booster dose. Yes, so that is what. But for those people who have taken Johnson & Johnson, it is a 1 shot. However, now the recommendation is that you should get a second dose 2 months after you get your first dose, and a booster shot is recommended, especially by mixing the vaccines. If you took what you call viral vector, so if you took either AstraZeneca or J&J, we recommend now you take Pfizer or Moderna.
Teenage numbers remained low even after the Ministry of Health advised that the Pfizer COVID-19 vaccine should be offered to children over 15 years old.
There's also been a setback. I think last week you may have seen in the media the High Court put instructions that we cannot vaccinate persons below 18 years of age outside medical institutions. That means we can't go to schools, we can't go to churches, we can't go. It doesn't mean they are not going to be vaccinated. They can be vaccinated at medical institutions. And the issue that we are addressing is how you obtain consent.
The sustained efforts of mobile clinics taking vaccines to hard-to-reach communities in a vaccination drive that hopes to move COVID-19 from being a pandemic to endemic, which means that the disease is at a level that is not causing significant disruption in the daily lives of people.
COVID-19 vaccines were not meant to stop infection. They were not going to stop an infection from getting into your respiratory system. What they are doing and why they are being used is to prevent you to get severe disease. So you get the infection, but you will not develop severe disease, there'll therefore be no need for you to be admitted. There'll be no need for you to go to ICU. It will be mild symptoms and you'll overcome them. So people should not expect that once they are vaccinated, or if they had a previous infection, that they will not get another infection. This is a viral disease. It is spread by droplets, it's spread by contact. So the most important thing to remember is if you are vaccinated, the chances of being admitted, the chances of death are reduced.
Nairobi County has the highest number of fully vaccinated persons. The uptake is still low in Tana River, Mandera and Marsabit counties.
We had set some media targets by 30th of June. We wanted 19 million adults to be fully vaccinated. That would be 70%, which would have been a very good level for herd immunity. However, we've just done about 8.8 million, so below 50%. We had hoped to have administered 4.2 million booster doses. But currently we've just done 460,000. So the uptake has been low.
The Ministry of Health says the number of COVID-19 infections is worryingly high and is calling on politicians to sensitize the public on observing health protocols ahead of the August polls.